Good afternoon, everyone. I would like to welcome you all to the Manatee Tiger Bay luncheon today. My name is Xavier Bailey, and I am your president. We will have First Sergeant Ryan from the Sarasota Military Academy cadet lead us in our Pledge of Allegiance.
Ladies and gentlemen, please rise for our national anthem. I'll start singing. Please place your hand over your heart in honor of our nation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated.
Please give First Sergeant Ryan a round of applause. Thank you to the Sarasota Military Academy for bringing your cadets out. It is not easy as you think it may be to come up, but this is what they're learning how to do, how to interact with adults, us, in the real world. So we thank you again so much, sweetheart. You did a great job. I would like to recognize our veterans and any active duty members in the audience. If we have any, please stand. Thank you so much for your service. Please silence your cell phones at this time. If you think you have silenced them, please check again for me. Today's topic: how will Manatee County's healthcare community continue to provide quality care with rapid growth, debate over vaccines, and the concerns of quality healthcare? Our speakers today will be Jennifer Binti, Dr. Jennifer Binti, County Health Officer, Florida Department of Healthcare for Manatee County; Randy Kern, President of Chief Executive Officer, Blake Medical Center; Dr. Chris Davis, Founder and CEO, Reveal Vitality and Manatee Cardiovascular Wellness Institute; Dr. George Van Buuren, Pediatrics, Mcr Health; and Alesha Vernon, advocate for free market principles in healthcare since 1985. Now, I will not read the bios. We have placed them online for our members to read. So I hope that you are reading those bios, because we want to make sure that our panelists have time to talk. Really quick, before I introduce our first speaker, which would be Dr. Binti, I want to just make a quick note for all of our members and our visitors today. Manatee Tiger Bay is here to provide topics that are going on in our community on the state and federal level. This is not about Republicans. This is not about Democrats. This is not about independents. This is about people. And we have our cadets here today. These are our youth for tomorrow. So we have to show them as adults that we can agree to disagree. So if you do not like my topics and the people that we are putting on the panels, please send us an email. We try to do our best to make sure that we are bringing both sides of the information, because that's what we do here at Tiger Bay. So please, please, it's all about debating, guys. Let's just all get along. And that's my say. Our first speaker will be Dr. Jennifer Binti. Please give her a round of applause.
Thank you, Xavier. Thank you so much for the opportunity to be with you this afternoon. I'm first because I guess I'm going to be setting the stage for healthcare in Manatee County, and you have our executive summary of our community health improvement plan with you, so I'm going to be walking through that in just a moment. But to let you know, first and foremost, Manatee County ranks 19 out of the 67 counties in Florida related to healthcare. So this is a yearly process that's done by the Robert Wood Johnson Foundation across the country to assess the health of a community. There are numerous indicators involved in this process. I would encourage you to go to the website Florida Charts, where this information is detailed across the counties, but you can get specific information about Manatee there. Overall, 40% though of these measures are socioeconomic in nature. So education, employment, family and social support, community safety even play a large role in the health of our community. 30% involve health behaviors or personal choices related to, for example, tobacco use, diet and exercise, alcohol and drug use, sexual activity, and even vaccines. 20% is related to the access and quality of our healthcare system, and 10% is environmental, such as air and water quality. Our current Community Health Improvement Plan, or CHIP, is a 5-year plan, and you can see in the back of it all those who participated in this process. We have done it every 5 years. It's going to start in January, becoming a 3-year process. And what we do is we survey, interview, have focus groups with thousands of people in our community to determine what their priorities are for health, and then integrate it with the data that we have based on those indicators that I mentioned. So if you go to page 4, you'll see the priorities in our community related to health. As I mentioned, some of them education, but also homelessness, mental health, something that we all need to spend more time talking about and addressing. Even technology and transportation, always a major factor as well. If you move on to the next page, you'll see our top priorities from our residents in no particular order, but they are there, and you'll see some similarities. What we have done on page 6 is looked at areas by focus. So for example, there's committees working on 0 to 5-year-old coalition type issues. So these people come together in our community, meet monthly, and address issues such as infant mortality, for example. While it's going down for the white population, and it has gone down overall in our community, it still is higher in the minority populations. The child death reviews, I sit on that committee, and it's very heartbreaking every month to go and listen to those children who have passed away in our community, predominantly due to unsafe sleeping practices, but also injuries and drownings. When we talk about school-age children, we move into issues such as students working against tobacco, looking at the vaping, the tobacco issues. We also have something called It's Your Choice, which is building self-esteem through peers in our middle schools and high schools, talking about everything from anti-bullying to teen pregnancy prevention. Furthermore, when we talk about the adults, we're harder to change our habits. We work very closely with the Chamber on wellness initiatives for businesses and how we can get people to be active even during the business workday. And we recently received 2 grants in our community, one related to opioid prevention. Our numbers have been high, particularly with fentanyl deaths in our community the last few years. While we did see a decrease, we are starting to see an increase again. So we're educating the community and the physicians about alternatives to opioids, as well as working with peers in our community to help those who are addicted at this point and can need assistance in transitioning off those medications. And we also certainly want to look at our aging population as we all grow older. And we received a grant recently to focus on age-friendly community, particularly falls prevention. We have a trauma center in our community, and we're seeing that a third of those clients there are actually falls patients. The others obviously being motor vehicle and injuries related to violence. Also, suicide is an issue for all age groups. We're looking at it as well with the seniors in this grant. I mentioned mental health, can't say enough about it, huge priority. We need to start early with prevention efforts in our youth, and then early intervention and treatment as well. And then those emerging infectious diseases, which we deal with daily at the health department. Particularly now in our county, our state, and our nation, we're dealing with a hepatitis A outbreak. We have 127 cases currently this year in Manatee County. Last year we had 3. Other counties have hundreds, 400 or 500 cases. But the bottom line is proper hand washing can help us in preventing disease spread. I've encouraged you to please take these with you, put those in your public restrooms on the mirrors. These are from the health department, how to do proper hand washing. Flu season is upon us as well, and this will help for many different diseases. I will stop there and hope to spend more time with you later answering questions. Thank you so much.
Thank you once again, Dr. Binti. Next, we will have Randy Curran, President and Chief Executive Officer of Blake Medical Center. Please give him a round of applause as he comes to the podium.
Thank you. I want to extend my appreciation for the opportunity to come and speak with you today. And just on a personal note, I was talking to Fred when he first came in and introduced himself. Seeing the cadets here, it takes me back. I actually went to boarding school, military boarding school, when I was in high school. And, you know, it's good to see these individuals out in the community learning what it's going to take to be successful in life. I know you do it every day in school, but this is a big piece of it. So thanks for being here. And then hand washing 101, I've always been told that you have to sing happy birthday. That's right. So you can't just wash your hands real quick and get away. If you truly want to kill the germs, sing happy birthday while you're washing your hands with warm water. So that's my nugget for the day. And you know, before I jump into a little bit about Blake Medical Center, I want to comment on what Dr. Binti talked about with respect to the trauma program in Falls. I know probably for the lay person, and I am not a clinician, let me say that first and foremost, but for the lay person, it's easy to gloss over falls. She mentioned falls, particularly as it relates to our aging population. That's critical, and I'll tell you why. For an individual over the age of 65 who suffers a fall and a hip fracture, that individual, if they don't make it into the OR and have that fracture reduced in less than 24 hours, they have a almost 40% chance of mortality 1 year post-op. And the reason for that is blood flow is restricted, right? So the sooner they get in, the sooner that fracture is fixed, the sooner blood flow starts. And for individuals that are over age 65, that means a lot. And you know, certainly appreciate what the county is doing, the health department in particular, to raise awareness around that. That's something that we're very passionate about with respect to the trauma center. So a little bit about Blake Medical Center. Blake Medical Center is the largest acute care hospital in Manatee County. We have 383 inpatient licensed beds. We also have a 28-bed inpatient rehab unit. But Blake really is part of a larger organization, and people may not know that as well. We're part of HCA Healthcare. HCA Healthcare is the largest hospital operator in the United States of America, both in terms of revenue as well as number of facilities. There's a lot more to HCA than just hospitals. There's a lot more to Blake than just the hospital, and I'll talk a little bit about that in a minute. But in particular, Blake is part of what we call the West Florida division of HCA Healthcare. In the West Florida division, there are 15 hospitals. There are 14 surgery centers. There are 8 freestanding EDs. One of those is here in Manatee County in Lakewood Ranch. And there are over 48 physician practices. Here, Blake Medical Center, as part of the enterprise, has the facility, as I mentioned. We also have a multi-specialty physician group, Pinnacle Medical Group. We also have a surgery center, Gulf Coast Surgery Center. And then finally, we have a GME program that's a partnership with the University of South Florida. And we have 48 residents on campus here in Bradenton. And I'll talk a little bit about why that's important as we move forward. So what does Blake Medical Center mean in terms of the impact to Manatee County as an employer and provider of care? We have about 1,600 employees here across that enterprise that I just mentioned. And our salaries, wages, and benefits on an annual basis is about $128 million. So Blake Medical Center is a big employer here, and it means a lot in terms of everyday life for Manatee County residents as well as visitors. Equally as important, I think, is to note that we also provide about $10 million annually in taxes to Manatee County. and provide $24 million in charity and uncompensated care on an annual basis. Those are our most recent numbers for 2018. Dr. Binti mentioned we are the Level 2 Trauma Center here in Manatee County. We're one of 2 trauma centers in Trauma Service Area 13. That's an honor that we have, along with Sarasota Memorial. Those counties that are in Trauma Service Area 13 are Manatee, Sarasota, and DeSoto. As part of our trauma center, we also have a burn center. I always talk about numbers with our orientees. There are over 300 hospitals here in the state of Florida. There are only 35 trauma centers, and there are only 6 burn centers. So the services, and these are just a couple of the services that we provide at Blake Medical Center, but when you really start to look at the numbers, you can be proud that here in our community, we have a access to high-level health care right here at home. And that means a lot for people to not have to travel. It's very expensive, as we all know, to receive health care. You add on top of that travel, expenses, hotel, et cetera, then it really starts to add up. So what are we doing as an organization, as a facility over the next number of years to help accommodate the rapid growth that's anticipated here in this community? I know the UF study said that we're expecting a 40% increase in population by 2030 and an almost doubling by 2045. So that means a lot for our community, and in particular, as it relates to healthcare services, Blake Medical Center is focused on expanding our current footprint, adding additional technologies, and adding additional services. So in the expansion arena, we're currently under the process of expanding our emergency department. It'll be doubling our our monitor bed capacity to accommodate for growth that we anticipate. On the technology sector, robotics is continually becoming more and more of a focus in healthcare every day. We're the only center in Manatee County that has 2 XI robots, and I'm not trying to get nerdy on you, but those are the general surgery robots, their latest generation. We also are the only facility that has the spine and hip and knee technologies that allow our surgeons to provide minimally invasive surgery. Why does that matter to you? That matters to you as a consumer of healthcare, less blood loss, it's opioid sparing oftentimes, and you get out of the hospital quicker and you get back to normal quicker. That's the whiff a minute for us as healthcare consumers. One of the other things I'd like to talk about on the technology side that HCA Healthcare has added that's really starting to, is changing lives is part of artificial intelligence. They call it SPOT, but it's sepsis awareness. And that's a major cause of death every day in the United States of America. And so we've got technology that we can use to trove data that we've had over years and years to identify patients that need to be immediately interacted with as it relates to sepsis management. And then finally, on the services side, we talked about, or I would like to talk about the addition of services like neurointervention, which is a program that we've got that we launched actually Monday of this week, which will position us to be a comprehensive stroke center by the time we get accreditation, which is a tremendous addition to the community. Across the entire continuum, from the time a patient comes to the hospital to the time they go through rehab, they can stay here in Manatee County and, like I said, help to keep that out-of-pocket cost at a minimum. So my time's up. I'll sit down now, but I'm sure we'll be getting into other topics that I'd like to talk about as we move on. So thank you.
Thank you once again, Randy. Next, we'll have Dr. Chris Davis. Please give him a round of applause as he comes to the podium.
Well, thank you guys, first and foremost, for having me here. I see a lot of faces that I know from Blake Medical Center, and so I'd like to say hello to you guys first and foremost. But everybody else here, thank you guys for having me here. I'm going to be talking about a subject near and dear to my heart, the quality of health care. And it's not specifically quality of health care in Manatee County, but really the quality of health care in general in the United States. You know, by training, I'm an interventional cardiologist, and I practiced for about 13 years before I kind of got frustrated with our healthcare system, truly providing the care that we should be providing for our clients. How long do you guys spend with your doctor when you go to your doctor's office? Anybody want to raise your hand and just say, when you typically see your doctor, how long do you, anybody know what the average length of time is?
Maybe 12 minutes.
Okay. The average length of time is about 7 minutes you spend with your doctor. Okay. So honestly, in practicing for about 12 years and spending that 7 to 10 minutes with my patients and seeing 40 patients a day and looking through those charts and understanding all the things that I truly could help with, but didn't have the time to do because of the system we were in, I figured that I needed to do something different. And so I decided to step out of the traditional healthcare and say, you know what, I'm going to start a program where I truly educate people to take care of themselves. Anybody know what the word doctor means, the Latin root of doctor? What does that mean? To teach, right? So what am I teaching you in 5 minutes as I spend 5 minutes in the room with you? Not much, right? So when we think about how much money we spend in the United States on healthcare, where do we rank as far as the amount of money we spend on healthcare in the United States? Where do we rank among industrialized countries? Number one. Number one. Where do we rank with regard to the World Health Organization quality of care? Where do we rank as far as quality of care? Number 47 of 50 every year for the past 10 to 12 years. So we spend more money than any other country, but the quality of health care is 47 to 50th. Why is that? We spend a lot of money in the wrong places. We don't spend the money in the education of each of the people who are sick. We have a great healthcare system when it comes to acute care management. Okay? When we are dealing with heart attacks and strokes, we have a great healthcare system that deals with the broken fractures that Randy's talking about. But when it comes to chronic healthcare issues like diabetes, like heart disease, like arthritis, like the autoimmune diseases, we do a fairly poor job of managing those things. And where does the management of those things start? It starts with what's on the end of those forks right there. But we don't talk about those things. And so I started a separate practice, Reveal Vitality, with my cardiovascular practice. They ran hand in hand for a while until I really saw what was happening as I started to educate people what they truly should do with their lives to maintain their health. The people who got off their diabetes medications, the people who got off their hypertension medications, the people who lost 50, 70, 80 pounds by just spending the time to educate them what they really should do. And so for me, it was a wake-up call. I'm seeing 40 patients a day. I don't see my kids grow up. I'm in the hospital all the times of the night, morning hours. And I felt like I was shackled to a system that's broken. So it was time to do something different. And it's been amazing over the course of the past 2 years what's happened as I sit down and we educate people about truly how to take control of their own health. Because the bottom line is whose responsibility for your health? Each and every one of you guys, right? Each and every one of you guys have the responsibility, your own responsibility to maintain your health. So for me, it's been truly an amazing experience to see what we've been able to achieve in these people. And I would encourage all of you guys, if you haven't, visit the Reveal website, look at the testimonials, look at the people who've lost the weight, look at the people who are no longer on these medications. And I really fault the system, because this is the way we were taught. I was taught as a cardiologist that, you come in, you have your heart attack, you need a statin, you need your beta blocker. That's what I do, right? But never did we talk about all of the other things that were important in preventing that heart attack again. I use this, and sometimes I get a little afraid to tell these numbers, but I'm going to tell you some examples of things that happen. As a cardiologist, I put a stent in your leg, and we get paid $15,000 to put a stent in your leg. 6 months later, 8 months later, you come back and that stent's closed up and we do it again. 6 months later, we come back and we'll do it again. But how much does the government pay me to teach you to prevent that from happening? 0. They don't pay me to teach you how to truly prevent that from happening, but will continue to pay me over and over to do the same thing. So that's a problem that we have with our healthcare system. So really, my goal for you guys is I want you to wake up and really take responsibility, educate yourself about how to truly achieve optimal health. And again, I encourage you guys to look at our website, understand what we do, understand the importance of and how we can affect lives and come off of medications and truly make a difference when you educate yourself. So I thank you for the time that I've had, and we'll have some more questions, I guess, a little bit later. So thank you guys so much. I appreciate it.
Thank you, Dr. Davis. Next, we will have Dr. Van Buuren from Mcr Health. Please give him a round of applause as he comes to the panel, please.
Thank you for having me. Why do we immunize? Immunizations in children, that's what I do. It's a preventive health measure. Who in this audience has seen a case of pertussis, whooping cough? Okay, a couple people. Who has seen a case of measles? A couple more, okay? Who has seen a case of meningitis due to Haemophilus influenza type B? Okay, a handful of you guys, probably in the medical profession. But anyway, those things when I first started practice were fairly common. Now they're very rare as a result of immunizations, okay? So as a public health measure, immunizations have been very, very important in reducing disease. Now, most people remember smallpox. Does anybody remember smallpox? Okay, smallpox is the only disease that I know of that has been eradicated through immunization. Okay, that was I remember lining up to get my smallpox vaccine. Haven't seen a case of it in years. Immunizations are important in terms of the health and well-being of our population. The more we immunize, at least the younger people, we can prevent a lot of these diseases and prevent those that may not be able to get immunized from getting those diseases through something called herd immunity. So it is important to vaccinate and vaccinate early, okay? As a pediatrician, I'm an advocate for my patients, and I would not advocate for something that I didn't believe was truly important in their lives. So yeah, I do advocate for my kids to get vaccinated because, again, I don't want to see those situations come back. I've seen people that have died from measles, Haemophilus influenza, meningitis, and things of that sort, and just don't want to do that anymore. Now, I know that there are a lot of issues with vaccines in terms of association with conditions like autism, okay? We don't think today that there's a link, but there are some people who still believe that, and they're entitled to that belief. However, me as a pediatrician, I'm going to focus on doing what I can to prevent illness and disease, and so that's about all I got to say. So I'll keep it brief and give you more time to ask questions. Thank you.
You all are doing great on time. I appreciate it. Next, we'll have Alesha Vernon, advocate for free market principles in healthcare since 1985. Please give her a round of applause as she comes to the podium.
It's a lot of pressure. My husband's right there. You screw up, it makes me look bad. Just kidding. So I volunteered to do this because I really don't think there are many people like me who are consumers and really pay any attention to what's going on in the healthcare industry. But I was an advocate for consumers in Georgia for at the state capitol for 10 years. So I really studied this issue from the consumers, the patient's perspective. That's where I'm coming from. Think about it, everyone else that's really studying the healthcare industry, their perspective is framed by their profession, their source of income, or they benefit from the present medical market in some way. I don't. But my perspective is really based on one visual aid. Everybody pull out your phone. But you all have one. This represents a free market. Not one government agency influenced the innovation, the quality, or the cost. Instead, it was you and me, the consumer, determining market share and market trends.
The cell phone industry is always evolving using the invisible hand of competition in the marketplace. Competition has forced inventors and manufacturers to beat their competition for that piece of the market share pie. It's well known that the vast majority of the inventors and the manufacturers failed over time. Only a small percentage were able to make a profit over the long term, and we all know you cannot make a profit over the long term you cannot stay in business over the long term without a profit, and you can't make a profit without, repeat after me, class, this is my instructor in college, repeat business and referrals. Thank you. You wouldn't believe how many times she repeated that. It stuck with me. Now, on top of that, we've got trends. It's a well-known marketing fact that trends are started by consumers with above-average intelligence, above-average education, or above-average income. According to all the market gurus, they set the trends. They're referred to as the trendsetters. In other words, if a product is very good or very bad, the trendsetters are the ones that discovered it and they told their friends. Now back to your phone. No one here was forced to buy a phone by the government. But we all have one. Now about healthcare. If government is forcing me to buy something, it must not be very good. Just saying, okay? If someone has to protect their market share by using the force of government, they probably aren't very good at what they do because they need government's help. Just saying. All right, so if a product makes a profit in the free market, it must be making a lot of consumers very satisfied. Why is it? Repeat after me. What is the reason? You can't get market share without repeat business and referrals. And the market trends are set by who? Above average education, above average income, and or above average, education, intelligence. So healthcare should be more like the cell phone industry. You and me should be determining market share and market trends. That's why I'm against forcing parents to have vaccines. If a parent doesn't want their child to be vaccinated, they're probably listening to a trendsetter.
Whoa. Please give her a round of applause. So, thank you all for coming up and giving your introductions. We will now have questions from our members. You must be a member of Tiger Bay to ask a question. Please do not elaborate on your questions. We want to get as many questions as we can in today to allow our panelists to come up to be able to answer your questions. We did have a few online. I don't know if they're questions, but I tried to put them together. Out of everyone that has gotten up and spoken about their expertise, we've had vaccines, we've had free market, we've had a CEO from a hospital, we had someone who focuses on your body and healing yourself with natural and changing your diet, and then we have someone from our health department. Who on this panel disagrees with the other? And this is a fair question. And this has nothing to do with getting anyone to go against each other, because Dr. Davis says that this has changed. And I look at the website and it says we're trying to, Blake focuses on the bottom line and making sure they have the best health care. How do these things interact with each other? Is there any way that we can come together with what Dr. Davis does and what the hospitals do to make sure that our patients are receiving the best quality? Anyone want to go?
I can comment on that.
Okay.
You know, I'll comment on that. I don't think that there's not a hospital, I don't think there's a hospital issue. I think I mentioned acute care versus a chronic care. When people end up in the hospital, they're often very sick, and it's very important to have the appropriate approach in the hospitals. The problem is that we do a really poor job, that so many people end up in the hospital that they probably don't need to be there if we were to educate them like we should be educating them in the first place. So I don't think there's a discrepancy in what we're saying. I think that there just needs to be a better approach to how we're truly treating patients, so that we don't need so many and end up with people with diabetic ketoacidosis in the hospital and getting treated if they were treated appropriately in the first place. So I don't think that's, we're not saying two separate things.
Randy, do you have any education once they come into the hospital? What type of education programs do you have for your patients while they're in the hospital?
Well, we provide community resource education for any patient that comes to Blake Medical Center, and any hospital I've been at, we've done that. And so, it's important for organizations in the community to make sure that we're aware of the services that are available and that are offered, so that we can continually educate both the community and visitors who come. And I'll echo what Dr. Davis is saying, which is, I think if I look at it from my perspective, I think we in the United States of America culturally have, we cherish life, right, here in the United States of America. And I'm not saying others don't. I'm just saying that everyone tries to hang on to their loved ones as long as they can. And when you get to the point, like Dr. Davis said, when people get into the hospital acute care setting, it is very expensive. And so, I had the pleasure of working for an organization at one time that had an insurance product. And so we had a Medicare Advantage product, and CMS lets you know what the cost of care is for last year of life for Medicare recipients. And when you look at the data shows that a very small percentage of the population of Medicare beneficiaries, 10% in our data, drove 50% of the cost. And so the challenge becomes educating our families, educating ourselves on end-of-life care, and the benefits of palliative care, of hospice, among other things. But I think that's a big opportunity for us culturally here in this country.
Any questions from the members? Any questions from any of the members? Yes, come forward.
Thank you. Steve Vernon, and I'm on the board of Tiger Bay. I'd like to ask Randy, essentially, the certificate of need has been changed through legislation, and now individual hospital people who want to open hospitals don't need a certificate of need. The reasoning was, from the legislative standpoint, that they wanted to open up competition, open up free markets, and not be restricted by that particular regulation. How do you feel about that?
Organizationally, we have multiple states across the United States of America where we operate both in a CON as well as a non-CON environment. For us, organizationally, HCA Healthcare, Blake Medical Center in particular, it's just a change in the operating environment that we'll adjust to. I think the state, if you look at other states like Texas that have moved in this direction, there's pros and cons to it, I think from numerous perspectives. But at the end of the day, as you said, the state made a decision to move in this direction, and so we'll make sure that we organizationally are continuing to do what we have done, which is ensure we're providing the best care possible to the members of this community.
Next question, please.
Hi, I'm Jane Filesticker, and I am a member. And my question is really for all of you who are in healthcare, and any who wish to respond, please do so. As you know, we have a healthcare advisory committee here in Manatee County that advises the county commissioners as to what steps may be taken in the future to improve healthcare. And what I would like to know, there are a few members of that committee in this audience, including myself. I would like to know what each of your highest priorities would be to either add to or change the Manatee County policies towards healthcare locally, right within our county.
Randy's gone twice, so it just needs to.
Great question. Thank you for asking. As I mentioned earlier, our community health assessment, community health improvement process will be starting again in January. However, a few other groups, particularly Centerstone, has already done one this year due to their regulations that were aligned a little bit differently in the past. But obviously, mental health, behavioral health, getting to youth, prevention is key, regardless of what topic we're talking about. And trying to spend more time assisting our youth on that issue is going to be extremely important. Finding a screening tool that really works to assist from a behavioral health standpoint is something that we're all looking at and looking for. I think the other issues pertain to the opioid crisis, still a tremendous problem in our community, and again, can be prevented. So trying to focus on our children, again, the grade level reading, we talked about that earlier. We really have to do everything we can to get our children off to a good start, physically, mentally. I failed to mention earlier about the importance of breastfeeding, our Wic program. We work with the hospital, Manatee Memorial. Majority of deliveries in the county are done there. Our Wic team is right there to educate those clients, those women, before they deliver, when they deliver, to help them and the children for 5 years for good nutrition and other habits. So dental, another good piece that we talked about in the group earlier privately, so important to the future of our children. Again, building self-esteem, but also avoiding a lot of diseases because of poor health hygiene in the mouth. So a lot of factors, and we look forward to all of you hopefully participating in our process as we move forward to make sure we're not missing anything when it comes to the health improvement plan going forward next year. Thank you.
Dr. Conard, I'm going to quote you here. 75, according to Dr. Conard's writing back in, I forget what year this was, oh shoot, I can't read. 75% of healthcare spending is for chronic care. And my only point here is the best way to treat chronic care is through nutrition and education. It's I could give you a whole bunch of data, but unfortunately, it's virtually illegal to allow a very well-educated nutritionist to help a patient. And if we could somehow figure out a way to allow for more competition in the nutrition market, you're going to see this cost drop.
Health education, 1. Access to dental care, 2. Access to primary care, 3. Okay. Access to specialty care, 4. And affordable health care for all, 5.
Any other comments on this? Next question, please.
Yes, Dr. Conard here. I am a member also. Statistics in our country reveal close to 400,000 unnecessary deaths every year in our country, mainly in the hospital setting. We've got a huge hospital problem in this country. Now, my question is mainly based around how do the panelists define quality of care and safety of care? We realize that a third-party leapfrog organization evaluates safety. If we look at the safety of 2 of our 3 hospitals in the county, they're very average in their grades. So I would like to know how you define quality, and how do we then, especially through the health department, how do we assure safety and quality?
Dr. Connor, who's your question for?
Pardon?
Who's your question for? For the panel? Or?
Anybody would like to respond?
Okay. Starting with Randy again.
Yep. Thank you, Dr. Conrad. I appreciate the opportunity to give you my opinion. Dr. Conrad's in leadership Manatee, and I had the opportunity to see him very recently on a panel that I was on, so good to see you again, sir. As he mentioned, Leapfrog is one of the third parties here in the United States of America that surveys hospitals based upon a standard set of expected outcomes. There are a lot of components that go into each of these surveys, whether it's the Joint Commission or DNB or Leapfrog. At the end of the day, Dr. Conrad, to your point, what we're focused on each and every day for every patient that comes to Blake Medical Center, whether it's Blake, Manatee, Lakewood, everybody in the United States of America is focused on the same thing, no harm, right? We want you to leave the hospital better than when you got to the hospital. Hospitals are extremely complex organizations, as I'm sure everyone knows. Average length of stay, 3 days. A patient will have more than 60 different individuals come in contact with them. That's not the number of contacts, that's the number of different people that will come in contact with them. So a hospital has to be a high reliability organization. We focus on process, and the challenge is we also we have people that execute on process, and so deviation from process can lead to harm. But each and every day we're focused on ensuring our processes are adhered to. We got the right people in the right role, and we want people that come to Blake Medical Center, as every hospital in the United States of America does. They want the people to leave better than when they got there.
Regarding the role of government in regulation, in Florida, we have an integrated Department of Health, and we have a lot of agencies beside the Department of Health. I always ask this trivia question: does anyone know who regulates restaurants and inspects restaurants in our state? Health Department. No, we do not. We're one of the few states that do not. It's actually the DBPR, Department of Business and Professional Regulation. However, if there's an outbreak at a restaurant, then we get involved to find out what's going on. But when it comes to regulatory issues at the health department in each county, and again, we are a state entity. We are all state employees for the Florida Department of Health. We have an integrated system. Most states have their local health departments that are overseen by local boards of health. That's not the case here. But in terms of our health department, in terms of regulatory processes, probably environmental health is the most regulatory. So we're monitoring beaches, we're monitoring public pools. So there's fines and variance processes that clients can become involved with our staff. But our goal is to go out there and work with the clients to make sure they're in compliance for those type of issues. When it comes to hospitals, at the national level, Joint Commission oversees hospitals, and at the state level, it's the Agency for Healthcare Administration, also known as AHCA. So they oversee the hospital systems as well as nursing homes. When it comes to trauma centers, though, that's where the Department of Health comes in, and I had the pleasure of overseeing that department in Tallahassee when I worked there years ago, as well as EMS. So those two systems are overseen by the Department of Health, and very important to us because of our role in disaster preparedness. And so after 9/11, we've spent a lot of time working with these entities as well as many others to build capacity to make sure we're ready for any type of events that occur in our communities. We also have medical quality assurance, again, at the state level, Department of Health, that oversee physicians. So if anybody's doing fraud cases or abuse, you hear about that with doctors, that's, again, our role, but through a state entity there. And then we oversee the healthcare providers. So anybody who has a license to practice nursing, dentistry, medicine, again, Department of Health, and those who do nails and other types of technical non-healthcare related services in the community, that's DBPR again. So they do restaurants and the non-healthcare, just to summarize in general. Hope that helped. Thanks.
I'd like to just I want to comment on the difference between the quality of care and hospital care and just outpatient care in general. And I think one of the other reasons that I decided to pursue a different avenue was the frustration in having to check boxes because of quality of care, and boxes that I didn't necessarily agree with. So we all have electronic medical records, and the medical record is basically, if you think about it, it's the checkbook. That's how we get paid, if the boxes are checked. So in a practice where there are things in these boxes that have to be checked, and I don't agree with, if I don't check those boxes, I'm getting messages from insurance companies, messages that I didn't do something correctly, when the quality of my care is in the patient's eyes, and you look at what's happening to the patients, not what's checked on a box. So when it comes down to how is quality of care determined, the quality of care is determined on what your patient outcomes are. And so one of the biggest problems we have is how the government has set up the regulations and where that quality of care is determined from. And so we really need to reemphasize and relook at who determines what quality of care is and how we're determining that, because it's not about checking those boxes.
All right, good afternoon. My name is Matt Bauer. I'm a board member of Tiger Bay. I want to dovetail a little bit off the quality of care. This is for any panelist. We haven't dove into it yet, and that's the pharmaceutical industry. So I haven't heard anything about that yet. So I'd love to hear your thoughts, especially Mr. Curran, Dr. Davis, and even Dr. Van Buren, as to how the pharmaceutical industry, you all know it's huge, how it might benefit you, how does it handcuff you, and how do you think it's affecting the standard of care, especially as it relates to the AMA guidelines?
Randy said one of you.
You open up a can of worms right now, Matt. Thank you. So my comment on that, I'm going to give you a couple of examples. When I give my talks on ways that we can help people with diabetes and heart disease, their fish oil has been around for years and years and years and years, right? But the pharmaceutical companies decided that we're going to make a purified fish oil. Okay, we're going to name it Lavazza, and we're going to charge about 10 times the price of fish oil that's been around for years and years and years. Okay. That's one example. The other thing about insurance companies, pharmaceutical companies, we're great at designing more and more expensive drugs and biologics, but we don't deal with the basic issues of what's causing inflammation in our bodies in the first place. Let's get their vitamin D right. Let's get them on the fish oil. Let's cut the gluten out of their diet. Those things that I've done over and over and gotten these people off of these. I have people on pulmonary fibrosis medicines that are $14,000 a month. Pulmonary fibrosis, gone. Those are the type of things that I saw happening, and I was like, this is incredible. This is just, I don't understand. Why was I not taught these things? So that in itself, when we talk about the cost of health care, we're all worried about who has insurance and who's paying for insurance. We shouldn't be asking that question. The question is, if we would put the money in the right place, we wouldn't have this issue in the first place. So you guys can see I get a little bit passionate about what I do because I realized what was happening in the society we were practicing in, and I said, I'm not doing this anymore. So anyways, that's thank you for asking that question, Matt. But
drugs cost, and they cost a lot of money. And I think that is the big issue. As a physician who does primary care, I have to deal with insurance companies as it relates to prior authorization. So there's a lot of extra bureaucracy involved with that, and that then means that there are people who have to review those authorizations and then counter back. So that's just adding to it. Obviously, there's a lot of R&D, research and development, that goes into the cost of these medications too, that have to be passed on. However, if we are looking at making sure we provide for everyone, we need to make sure those costs are not unreasonable. Okay, you have drugs that cost, as Dr. Davis mentioned, $14,000. There should be no way that I couldn't afford that drug unless I had some sort of program that was going to assist me. Okay, and just think about it. If I'm saying that I'm a doctor, then what about the person that doesn't have insurance that has the same condition? Now we can still do all the other things, and again, it really boils down to education. To answer the other question that was answered earlier, quality is defined by the end user. So you guys define what the quality is. All we're trying to be able to do as physicians is to track it and show, because again, we have people that are looking at us to say, are you doing a good job, okay? But in the final analysis, you guys do determine what the quality of the service is. Our job is to make sure that service is safe. So you want to leave better than what you came in for. So simple answer to that question. I don't know if that answered your question, Dr. Connor, but that's all I got.
You have a question, Ken?
My name's Kenan Piper, and I am a member. At 71 years of age, I'm lucky to have my 92-year-old mother still with me. I brought her down here 4 years ago when my wife and I moved down here. Since then, she's been in 1 adult family care home, 3 assisted living facilities, 1 rehab facility after she broke her leg in the first assisted living facility, and she's now in a skilled nursing home. I come into her room, I take a 15-second inventory. Eyeglasses are lost, hearing aids are lost, dentures are not put in, swelling in her legs, in her arms, which no one else notices, and I have to tell the doctors and the facilities about it. Going to ACA does no good. I've done that. Although when I complain about the facility itself, healthcare does come out, and they actually get something done. But that's the type of thing that I need for my mother. She's private pay, so she's not on the taxpayer dollar at all. But even reporting, when I report to ACA, they say, well, the day we came out, the problem didn't exist, so there's nothing more that we can do. Well, usually I would not be in favor of government regulation, but something more needs to be done for the 26% of our population that's over 65 years of age. And how would each of you resolve the problems that I've brought before you?
Thank you for sharing your story, and unfortunately, it's more common than most people probably realize if they don't have a parent in that aging population and dealing with the system. There's an ombudsman program that they should have the 800 number at the front door, and I can assist you personally with that afterwards. But there are programs like that to assist, because I know ACA's in Tallahassee, and they have regional representation. But again, there are some persons who are particularly retired nurses who are in those roles that can assist you and be an advocate for you and your family.
As we end our program, if the panelists can just come to the panel for me one by one, if you choose to, and just give me one word or an adjective on what you feel will be a barrier in the future. With medical healthcare is changing, what would be your one word that would be a barrier? Let's go. Barriers.
Health education.
Thank you. One word.
One word.
Oh, education.
I can't read a sentence.
You're good.
New York, what is this, U.S. News and World Report? I can't remember what the magazine is. It says the problem isn't that we have bad people. It says we have good people working in a bad system.
Thank you. One word. One word. Come on, you can come on up.
Data and facts versus social media, lack of the detail and the knowledge that should come with it. Sorry.
That's okay.
access.
Kudos to you gentlemen for doing the one-word thing. I can't do the one word. I think it's supply of individuals to provide healthcare in a growing, baby boomer population, growing population here in the United States of America. We've got a physician shortage as it is, nursing, et cetera, across the board. So I think it's going to be individuals to help with healthcare in the future.
Ooh, thank you. Please give our panelists a round of applause. Thank you so much for coming out today. We would like to remind you all that we do have our Pat Glass Leadership Awards dinner coming up on November 21st. If you have not gotten your tickets, please go ahead and get your tickets. We are almost sold out. This is a wonderful thing, and we just want to thank you all again for attending today. Again, please give our panelists a round of applause. Members and guests, you can see Elaine if you would like to become a member. Oh, Tiger by the tail.
Are you ready?
Mm-hmm.
I'm glad for the one-word opportunity. I'd like to play prevention. And thank you to all the panelists and to all of those of you who asked questions. We had some good ones today. And the Tiger by the Tail Award goes to Jane Filesticker for her question about top priorities in healthcare. Congratulations, Jane, and thank you.
Thank you so much. We would like to thank the following news media for your coverage of our luncheon today: Charles Clapsaddle and METV crew for taping and broadcasting our forum on METV channels and YouTube. Their website is metvweb.com. ABC7 WWSB News team for attending. Bradenton Herald and Sarasota Herald Tribune. You all have a great day. Thank you for attending.